Hello everyone, today we will get acquainted with 4 magical Chinese points that will definitely relieve your shoulder pain. Recently, I have been studying Chinese medicine more and more, and the deeper I dive into it, the more I realize that it fits very well with manual therapy and the rehabilitation models of Europe and America. Many of the points of impact coincide. And now we will get acquainted with the Chinese scheme of shoulder joint therapy, which was developed specifically for acupuncture. This is a tool similar to a Chinese needle, but with a slightly different sharpening for local work at the site of pain. In clinical settings, we often use shockwave therapy on these points, sometimes needles and sometimes acupuncture knives. But at home, you can try to work on these points using a massager or a special myofascial ball, or at minimum, a tennis ball. Let's begin. We're interested in 4 points in total. 2 points will work on the forward-backward movement in the shoulder, and 2 points on the lateral movement in the shoulder. See which movement causes you more discomfort. Try to touch your ear with your elbow and do a lateral raise with a straight arm. If you have pain or limited range of motion in this movement, you need to check the following 2 points. The first point is located in the upper third of the deltoid muscle, right in the middle. Try to palpate it deeply with your finger, and you will immediately find a rather sharp tenderness. If the point is active, the second point is located at the attachment site of the deltoid muscle. Just run your hand along it, and where you feel that the roundness of the muscle ends, press there, and you will feel a pronounced painful sensation. If the point is active, the next 2 points work for forward-backward movement. Try raising your arm all the way up and forward, and then move it back. If somewhere in the range of this movement you have pain or limited motion, find these 2 points. To find the first point, first locate the head of the shoulder. It's a rounded area right here. Next, place 3 fingers and slide them along the head, approximately through its center, closer to the armpit. Next, try to palpate this area a little and you will find the point of maximum tenderness. It will be quite dense and you can feel the bone underneath it. If you look at this on the skeleton, the point will be located right here. Basically, you find the head slide down, and right here, approximately where we have the metal structure, you will feel the point of tenderness. The third point is located very deep and is the hardest to palpate. The thing is, it is not located on the deltoid muscle, but kind of underneath it. This is roughly the area where the nerve exits, and most often the pain comes from the fact that the muscles surrounding the nerve exit are too tight, and we will need to massage them. To find this point, you also need to feel for the head of the shoulder, slide off it roughly through its center towards the back, and press very deeply with your finger. You'll have to search for this point a little longer. But if it is active, you will also find a sharp pain in its projection. Take another look at how it will be located under the deltoid muscle. This is approximately the area of tenderness. To find it on yourself, you can take a massage ball, go up to a wall, place it approximately in this area, and try pressing a little to find the spot where you feel the pain. And now I'll show you how you can massage these points at home. Now I'll show you how to find and work on these points using a massager. The first point is responsible for lifting your arm forward. To find it, I repeat, locate the head of the shoulder, move forward, and it's kind of a little bit in a hollow. Try to go a little further and look for it. Usually, if it's active, the patient will immediately tell you that it's painful. The second point responsible for this same plane of movement will also be located on the slope of the deltoid muscle, and very deep, approximately in this area. The 2 points responsible for pain during arm abduction will be located on the lateral part of the arm. To find the first point, measure 1/3 of the deltoid muscle right in the middle and go very deep. Look for tenderness. If it is active, the patient will definitely tell you where it is located. And the last point is located at the tendon attachment. That is, we go down to the slope of the muscle and look for the tender spot right in the middle. This is the Chinese scheme for treating the shoulder. For the massage, use a high frequency and preferably massagers with a high amplitude of movement. Place the massager piston on the tender spot and massage for at least 1.5 minutes. At the same time, you don't need to move to other areas or shift it. It's better to press the massager a little deeper and just wait for the tissues to soften. In the area of the front point, you don't need to press hard on the massager. It's more superficial than the point on the back. The deltoid, and we also work on it for about 1.5 minutes. Next, we move on to the remaining 2 points, which are responsible for the lateral lifting of the arm after working on these points. The tenderness during repeated palpation should become significantly less, and your pain when moving your arm should either go away completely or decrease significantly. If you use a massager to work on the points, do this massage once a day for about a week. If these points do not go away completely, you can use more intensive treatments such as shockwave therapy as well as acupuncture or a needle knife. It's better to work on the points using a massager, but if you have a tennis ball on hand, you can use it for massage as well. The only thing is, don't press too hard on these points. It's better to use movements to gently massage them and increase blood flow. To find the points that work for abduction, place the ball against the wall. Measure about 3 deltoid muscles. Put your hand along your body and press firmly on the ball. Try to find this position, and when you find a painful spot, make small circular movements so that the ball almost stays in place. Basically, only the direction of pressure changes. Move on to the next point and also use very gentle movements without applying too much pressure. Work on the point, 1 hole and 5/10 to 2 minutes. The most difficult point to find is located at the back. Try placing the ball on the rear surface of the deltoid muscle behind the humerus and find the most painful point. Here it is for me, right here. Also, with light circular movements, without applying too much pressure, work on it for about 1.5 to 2 minutes. To work on the front point, you can place a small ball and roll it with your hand. You don't need to apply a lot of pressure here. You just need to hit the exact spot, and using gentle massaging movements also work on this point. After this, you will feel a good rush of blood to the shoulder joint, easier movement, and a reduction in pain sensations. Treat your shoulders so they stay healthy and strong. See you next time. Bye.